You hear a general practitioner talking to a patient named Lisa Green. For questions 25 to 36, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Lisa. How can I help you today?
Hi, doctor. I've been feeling unwell for several weeks now.
I see. Have you traveled anywhere recently?
Yes, I recently returned from a trip to Southeast Asia.
Can you describe your symptoms?
I've been feeling extremely fatigued and have no appetite. I also had a fever last week.
Do you have any history of similar illnesses?
No, this is the first time I've felt this way. However, my mother had issues with her liver.
I see. We ran some blood tests, and your liver enzymes are elevated. Additionally, your ultrasound shows some abnormalities in your liver.
What does that mean?
It suggests there might be an infection or inflammation. I'm prescribing some medication for now and advising you to avoid alcohol. We'll need to see you again in 2 weeks for a follow-up.
Okay, doctor. Thank you.
You're welcome, Lisa. Take care.
You hear a pediatrician talking to a mother named Sarah Johnson about her son, Jack. For questions 37 to 48, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mrs. Johnson. How is Jack today?
He's not doing well, doctor. He's been sick for 3 days now.
How old is Jack again?
He's 7 years old.
What symptoms has he been experiencing?
He's had a high fever and complains of a sore throat.
Has he had similar issues before?
Yes, he's had strep throat a few times. Also, he's allergic to penicillin.
I see. His physical exam shows his throat is quite inflamed. His temperature is 39 degrees Celsius.
What should we do next?
I'm prescribing an antibiotic that isn't penicillin. Make sure he drinks plenty of fluids and monitor his fever. Let's schedule a follow-up in 1 week.
Thank you, doctor.
You're welcome. Take care of Jack. You hear a cardiologist talking to a patient named John Smith. For questions 49 to 60, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Smith. How have you been feeling lately?
Not great, doctor. I've been having some chest pain.
I see. Do you have any known medical conditions?
Yes, I have a history of high blood pressure. I recently experienced some dizziness as well.
Can you describe the chest pain?
It's a tightness in my chest, and I get short of breath when I exert myself.
Have you had any previous diagnoses?
Yes, I was diagnosed with angina last year. There's also a family history of heart disease.
We did an ECG and it shows some abnormalities. Your blood tests also indicate elevated cholesterol levels.
What does this mean for me?
I'm prescribing medication to help manage your symptoms. You should follow a low-sodium diet and engage in regular physical activity. Let's schedule a follow-up in 6 weeks.
Thank you, doctor.
Nurse briefing her colleague about a patient. Now read the question.
Mrs. Green was admitted last night for pneumonia. She came in yesterday with a cough, fever, dizziness and chest discomfort. She's a healthy 60-year-old with a history of right knee replacement 5 years ago. She's on a regular diet and has no allergies. She's at high risk for falls due to her dizziness. We changed her IV antibiotics to oral, which she's tolerating well. Her assessment is within normal limits, except for some mild shortness of breath and wheezing. Her vital signs are stable, oxygen saturation is 98% on 1 litre, and she's been comfortable during my shift. Around 5:30, I gave her 2 paracetamol for minor pain, with good results. She has an 18 gauge in her left arm. She's got normal saline at 15 mils per hour.
Okay.
You hear the manager of a care home for the elderly talking to the nursing staff. Now read the question.
Now, a quick word about the administration of medication. It's great to see how carefully you're all following the new guidelines, and thanks to this, error rates, which were always below average anyhow here, have dropped by 40%. The surveys we've done also throw up some interesting findings, like mistakes being more common in the morning than afternoons or evenings. We're not sure why, but there's a clear pattern. Also, we know that being disturbed for any reason while working out and preparing doses is a common reason for mistakes. So please, try and avoid distracting your colleagues while they're doing this. Finally, we must be on the lookout for drug interactions, side effects, and patient sensitivities. Fortunately, we haven't had too many problems of this nature, but the care needs of the vast majority of our residents are often quite complex.
You hear part of a morning briefing on a hospital ward. Now read the question.
Right, so overnight admissions to the ward. Greg, could you start us off?
Sure. We have Sue Deans in bed 5. She's a 54-year-old female who was brought into the emergency department by police overnight. She has a history of poorly controlled paranoid schizophrenia. She presents with chronic persecutory and paranoid delusions and also significant thought disorder. She's to remain in high dependency unit care until the stabilisation of her symptoms. We'll be observing her every 15 minutes and monitoring the level of her distress, psychosis, and any response to interventions offered.
Okay. I'll review the clinical and detention status this afternoon. Now, what's the plan for discharge?
Social work interventions required for placement and community support options, and that's been booked for tomorrow. Also, an application for the appointment of legal guardian may be required.
Right. We'll consider that at tomorrow's ward round.
You hear part of an antenatal consultation at a GP practice. Now read the question.
Mrs. Summer, how can I help today?
Well, I just wanted to check something.
Okay. So you're having a home birth?
Yeah, though everyone's on at me about going into hospital. I had my last child there, but I'm determined to be at home this time, to feel more relaxed as well as safe. But I wondered about an at-home epidural if I wanted it. Going without wouldn't put me off, though.
An epidural's out, I'm afraid, because we can't do it without an anaesthetist. Just pethidine or gas and air. But they're very effective painkillers.
Yeah, pethidine's good.
And you had a bad patch after giving birth last time.
Yeah, I got really depressed. I couldn't understand it. It was short-lived, though, and I'm better prepared now. It can't be prevented, but I have read up about coping strategies.
You hear a trainee doctor telling his supervisor about a problem he had carrying out a procedure. Now read the question.
So how's today gone, Harry?
Well, I'm afraid I had a problem taking blood from Mrs. Harris. I've done that procedure numerous times now, so I wasn't particularly worried. What I hadn't anticipated was the difficulty finding a vein. I suspect her illness means she'll have had a number of cannulas inserted over the weeks she's been here, and that's led to collapsed veins.
Well, that can happen with long-term elderly patients, and it's distressing for them if the procedure isn't done quickly.
Oh, she endured it without a murmur.
Hmm.
I'm sure I would have made a fuss in similar circumstances.
Well, I'll supervise you the next time you do it.
You hear a doctor talking to a teenage boy who has a painful wrist. Now read the question.
Now then, I understand you fell off your skateboard some days ago and injured your wrist. Is that right?
Yes, I slipped and put my hand out to save myself. My mum says I've sprained it.
You certainly got some swelling and bruising there. But I don't think your mum's right in this case. Does your wrist hurt?
It aches, but the pain's worse when I try to grip something.
Right. Well, I suspect you've broken what's called your scaphoid bone. It's a classic injury resulting from what you describe. I can't feel any other fractures. But you'll need an X-ray to see where the two ends of the bone are. If they're not meeting up properly, you'll need an operation to sort that out. But let's see the results first.
Okay.